Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa with PAR5 Physical Therapy, and I've partnered with them to give you an easy and educational workday session. So today's session is how to relieve that pain, that trigger point that you get underneath your shoulder blade. We're going to learn what causes that pain and spasms in your upper back, how to fix it, and how to prevent it from coming back. A little bit about me. I received my doctorate in physical therapy from Mercy College and my BS in exercise physiology from Rutgers in New Jersey. I'm a board-certified orthopedic clinical specialist and a level 3 Titleist Performance Institute golf medical professional. So feel free to use the chat if you're here, and let's get started. Now, because I am a medical professional, let me pull up my slides here. All right, because I am a medical professional, I have to always put up one of these slides that gives you this disclaimer that, you know, the stuff that we're going to be talking about today is very good and helpful advice, but it's aimed at a general, broad population. So if you're dealing with something specific, make sure that you have a thorough physical exam by a medical professional so that you can address all the root causes, everything that's connected, associative factors that's causing your pain. All right? And if you take away anything from my classes or remember one thing, remember this, that the body functions on an alternating pattern of stability and mobility. If that pattern is disrupted, then pain or injury is the result. So if we're looking at the thoracic spine or the T-spine here, that needs to be mobile. And that spot where the shoulder blade is actually supposed to be a stable segment, the scapula, right? The shoulder blade. And then the shoulder itself, the ball and socket joint, that needs to be mobile. So if we're taking into account all the things that are connected to that upper quadrant that we call it, behind the shoulder blade, we have to kind of look at the muscles that are connected there, all right? And all the structures that we're going to treat and assess today. All right. So here is a diagram of the thoracic spine, all right? It's T1, the first thoracic vertebrae, all the way down to T12, the 12th level in your thoracic spine. And you can see that each of these levels is connected to your ribs, all right? So it's a very stable part of the skeleton, right? So we have the cervical spine up top and then the lumbar spine below, all right? The cervical spine, the neck, it's made up of these tiny vertebrae, and they're so small, there's 7 of them up there, that we divide them into 2 parts, the lower cervical and the upper cervical, all right? The upper cervical is supposed to be mobile. The lower cervical is supposed to be stable, right? So if your posture is like always forward headed like this, we have the lower part of your cervical in what we call flexion, tilted forward, and the upper cervical in extension, right? So we don't want that. We want to have a better position so that our head is balanced over our shoulders. And as you can see in this next slide, the muscles that are connected to the base of your head that go out to the shoulder blade, all of that, they're working harder when your head is forward of center, all right? So they have to hold yourself up, hold that head up, you know? So there's probably diagrams and pictures that you've seen online or heard of a phenomenon called tech neck or tech neck. It's basically as we're working on our devices and looking down at them, our head is forward and we're always looking down. Now, typically, the human head weighs about 12 to 14 pounds, but for every degree forward of 0 or straight, it relatively increases in weight all the way down to 60 pounds if we're looking down at 60 degrees of flexion of the head, right? So 60 pounds of weight, that's like a small child on your back pulling on the upper trapezius. That's that big muscle you can see all the way on the left. It's cut away on the right side of the screen here, but you can see that trapezius muscle. It's big. It's so big that we divide it into 3 parts: the upper cervical, the lower, and the middle, right? So the upper, middle, or lower, right? So oftentimes when people come in to see me, they have very tight upper trapezius muscles because that part of the muscle is connected to the base of the head, and that's holding yourself up as you're trying to look down. Now, that trigger point, that thing that you get, like, oh, that knot in between your shoulder blade and your spine, That's probably one of these things right here. You could see the levator scapula, which is up top, or the rhomboids. So the rhomboid has a minor, has a major. They're basically connecting the shoulder blade to the spine, okay? And they move the shoulder blade, and they also kind of flex and extend a little bit of the spine, but their primary role is to control rotation and position of your shoulder blade as it sits on your rib cage, okay? Now, all of these muscles, when we talk about spasm, tightness, physiologically, a muscle can be tight in terms of short or being knotted up, and that's from a physical, musculoskeletal standpoint, right? But there are neurological or nervous system factors when we do get a muscle spasm. When a muscle turns on, it contracts, and it doesn't release 100%, and you get this little spasm that's in there, and you want to try and get rid of it. So if we talk about the nervous system and the autonomic nervous system, it's something that we don't control, all right? And we can break it down into the two divisions here, right? So we have a fight or flight, that sympathetic nervous system side when we are under stress or we need to activate certain muscles and our vision, our hearing gets attuned. Or the other side, when you have calm, or what I like to call the rest and digest side, that's when you're totally relaxed. You can imagine your nervous system, this peripheral nervous system, as like your body, if you were on vacation, on the beach, rest and digest, not really worrying about much, or in a dark alley and at night where you can't see much. So you're on heightened awareness, fight or flight, or rest and digest. Our body wants to be in the middle, homeostasis we call it, where we don't have too much of one or not enough of the other. We're kind of even. We can kind of go into our fight or flight when we're under stress, but we could also recover well and get in this rest and digest side. So we have these two components. And people with chronic pain or have a higher tendency of getting these trigger points or these spasms, they spend a lot more time over here, this fight or flight. And this could be due to fatigue, dehydration, what else? Stress. It could be poor diet. There's a lot of different factors that can say, hey, we're more aware of stimuli that come into us and we interpret as being a threat, fight or flight, okay? It could also be your environment, right? Like I said, like when you're on vacation, you're not going to spend a lot of time in this fight or flight mode. You're more in the rest and digest, but we want to have more relaxed. Now, talking about this spasm, we're going to take it back to if you have this trigger point in your back underneath your shoulder blade. If we're spending more time in this fight or flight response, it's harder to release that muscle if we can't get to this rest and digest side. The easiest way, if you are in a fight or flight mode or a muscle spasm or pain or anything like that, the easiest way to get to this rest and digest side is breathing. We can use our breath or breath work to reduce our level of threat, our sensitivity, our pain intensity. And there's a lot of different techniques. One simple one is I tell this to my clients all the time, is just go in and out through the nose. All nasal breathing, maybe a 2-second inhale and a 4-second exhale. So you have a longer exhale than you have an inhale, and you could pause at the top or bottom of your breath, doesn't matter. Some methods are 4-second inhale, 4-second hold, a 4-second exhale, and a 4-second hold at the bottom. So you're always that's called a box breath, right? But regardless of what your technique is, we're always going to go in and out through the nose and a long exhale. When we work on trigger points, when we want to relax muscle, we want to spend more time in this rest and digest, and we want to use that breathing pattern to help calm down our nervous system and make whatever technique that we're going to be doing next to relax that muscle to make it as effective as possible. Because when we start to do mobilizations to trigger points, we're trying to break something up or roll something out or stretch something, our first instinct is to tense up a little bit, maybe stop breathing, hold your breath, right? Gasp. So it takes about 1.5 minutes to kind of turn that down and actively get into a rest and digest state when we're doing something that might be uncomfortable. Now, I'm saying pain, anything that we do should not create pain. But again, if you are searching around for a trigger point and you press on it, it might be uncomfortable, but that discomfort should stop immediately if you relieve the pressure, and it's not worse afterwards. All right. So there's always a yellow light, red light, green light theory here, that when we go into exercise or stretching or whatever, if it's sharp, stabby pain, that's a red light. And if it's worse afterwards, that's a red light. There's something else going on. Or if it's like a little dull, achy discomfort when you get on that trigger point and it's no worse or even better when you relieve that pressure off that trigger point, that's a yellow light. We proceed with caution. And, you know, the green light is everything's fine. So we want to kind of stay in that more than ever. So anyway, so these are the things that we're going to be talking about next. Thoracic mobility, the thoracic spine that we mentioned earlier, is one of the mobile segments of our body. And soft tissue mobilization is taking any type of ligament, tendon, muscle, fascia, connective tissue, and mobilizing it, because our body is all these different layers of stuff that need to slide, shorten, lengthen, and move on one another. So we want to be able to restore that sliding component to these tissues. And then to prevent those muscles from going into a spasm again or getting triggered, we want to always include some type of strengthening exercise so that we can reverse a lot of those factors or causes, or root causes of the problem. All right. So let's get into that now. Let me pull up my two-shot here. All right. So thoracic rotation, that's the first thing that we're going to get into. I mean, thoracic mobilization. Our thoracic spine, right? If we're sitting and we're at work, inevitably we will get into a slouch position. This is me working at my computer, heads down, or I'm looking at my phone. Now, inherently, no position is bad. And there is no position, this might be a hot take and not a popular opinion, but slouching is okay. There is no such thing as perfect posture, okay? If you think about like, oh, I need to be like this 24/7. No, our bodies were designed for motion. We were never designed to stay in one position for too long. So when I say there's no perfect posture, your perfect posture is your next posture. All right. So inherently, if I'm going to be here working and I'm slouched, there's nothing wrong with that, but I can't stay in this one position for too long. So every 30 minutes, we want to be able to move and give ourselves options to lengthen tissue that might be short, or, you know, change positions, right? To give our body a little bit more input versus just like static in one position for too long. And that might be tough, especially if we're working on a deadline and we're really focused on a task at hand. We may forget that our bodies move. And then when we do go to move, there's usually maybe some discomfort or pain, and that's your body's request for change. Pain isn't an inherently bad thing. It doesn't mean that there's something broken, because pain can happen in the complete absence of any tissue damage. So we want to make sure that we listen to our body and always move whenever we can. All right, so back to this thoracic mobilization. When our body stays in one position for too long, it adapts to that position. We want to be able to move out of that and make sure that our body's as mobile as possible. So we want to reverse this kyphotic or hunched over position, which creates a lot of tension in the muscles in the back, and it can be a root cause to a lot of these spasms that we have in that shoulder blade area. So the first thing I like to use is this foam roller, okay? So you can get these foam rollers anywhere. They're ubiquitous now. You can even get them at Barnes & Nobles. I've seen them there. And they come in different densities, right? So they have ones that are medium, firm. They have very aggressive ones that are very thick, hard, and have knobs on them. You know, this is our medium density one. It's a standard black foam roller. It's 3 feet long, right? So we're just going to put that on the floor. And, you know, I did this with a client the other day. Is we want to be able to relax into this position. When we get on it, the first thing is like, oh, this might be uncomfortable. Again, keep in mind the breathing techniques that we talked about earlier, and we're going to utilize that as we're trying to stretch out or mobilize our thoracic spine. Now, when we talk about mobilization of the thoracic spine, that's all joint, right? We don't want to really mobilize soft tissue just yet, but we will get to that. In order to mobilize the joints in our mid-back, the big thing is that as we sit on here, and I have my hips down, my knees are bent, I'm not going to move this just yet. And the foam roller is on my thoracic spine. And I can kind of adjust that by moving my hips up and down. But I want to start on the lower ribs. All right? I don't want to start on the lower back. It's a little bit aggressive. Just start on the lower ribs. Okay? And in order for me to get into the joint, to manipulate the joint, I have to get past the soft tissue, the muscles back there. So if I'm relaxed and I don't stretch out that tissue by bringing my elbows forward like this or my arms around like this, I create tension in the tissue in the back in this position. And that allows me to, when I do this mobilization, to get to the joint versus just kind of pushing into the soft tissue. So whatever you choose, hands wrapped around tightly, separating the shoulder blades, or here, separating the shoulder blades. I'm going to keep my hips still, and I'm going to rock back. And this motion may be very limited to you. And the one thing that you have to watch out for is your lower back. Your lower back, your lumbar spine, we can't let that be unlocked and then just kind of hyperextend through that, okay? We want to lock that down a little bit. Use the abdominals to kind of push that part down while as we move, the upper thoracic, the thoracic spine on the other end of the foam roller goes backwards. So it's like a little bit of a seesaw that we're doing here. This stays down, and then this part goes back. And I'm going to oscillate a couple times at that level of my thoracic spine. And then I'm going to readjust and get to the next level. So I'm going to move that. Again, there's 12 levels in our thoracic spine, 13 joints. And we want to try and get to each one as I'm trying to reverse this kyphotic or hunched over position. All right. As we get up higher, again, it's very important that we keep this engaged. Keep the abdominals on so that as I go back, I'm not just hyperextending through my lower back. Okay. So we want to be very specific, especially in parts that are tight, because your body will move through the path of least resistance. What does that mean? That means that if we're trying to do a stretch, the tight spots like to stay tight, and the mobile spots like to move. But we want to reverse that because dysfunctional tightness or limited range of motion, we want to change that. And we want to be able to isolate the spots that we need to move. All right? So that's our thoracic extension. And I usually, go for about 2 minutes or so, depending upon how many times I do it at each level of my spine. It might take you 2 to 3 minutes to get through that. All right? All right, so the next one is going to be using a lacrosse ball or some type of implement. Now, I have a bunch of different options here. Let me grab them over here. I've got the yellow, which is the lacrosse ball. And then I have this is from triggerpoint.net. It's a trigger point ball. It's kind of harder, but slightly softer than a lacrosse ball. And I've got this ball here from Hyperice. This is actually a vibrating massage ball. So when you turn that on, it vibrates, and the vibration makes the trigger point release a little bit more comfortable, because pain and sensitivity, or technically pain, travels up a nerve to your brain, and it's relatively slow in the whole realm of nerve conduction speed. If I give the body vibration or deep pressure or actually vibration, percussion, light touch, those types of sensations travel up a different nerve, and that nerve travels faster than the pain signal. So if I have vibration and I'm using a foam roller to work on, or the ball to work on a trigger point that might be tender or sensitive, the vibration will help decrease that pain, because your body listens to the loudest voice in the room, and the vibration is much more dominant when we use that than the pain signal. But anyway, that spot I had in that slide earlier, that space between the shoulder blade and your spine, that's where you're going to put the lacrosse ball. And you can always do this sitting against the wall or against the chair if your chair back is high enough. But I like to do it lying down, because I can relax into that position and allow my body weight to just get onto the ball. All right? So I'm going to lay that down there, and I'm going to get into position and move my hoodie out of the way. And I'm going to find that spot. And it takes some time, body position, and playing around with where this ball is. and where my hoodie goes and all that stuff, until I find that trigger point. And I can kind of support my head with my hands and just keeping the shoulder and the arm relaxed of the side that I'm working on. I put it between my left shoulder blade and my spine. And I can move around and see, all right, where is it sensitive? And then once I get that spot, then we're going to use our breathing techniques to try and allow that soft tissue, that muscle, to melt into that ball or around that ball, right? So it takes, again, like I said earlier, 1.5 to 2 minutes for the body to relax, the rest and digest side to kind of be more dominant than our fight or flight response. So I'm just going to stay there. And that deep pressure and deep breathing will help that muscle relax. And because that muscle is attached to my spine and attached to my shoulder blade, once I find a good spot that I want to release, and I can calm down, deep breathe, and allow that tissue to relax, I could start to stretch it by leaving that ball where that trigger point is and moving my shoulder and stretching and lengthening that tissue. That becomes much more interesting, but allows you to restore some normal sliding components to that tissue. All right, so that takes about 1.5 to 2 minutes to do that, whichever way that you want to do it, either lying on your back or sitting in a chair. Now, I have this other implement too that I brought from home. This is called a back knobber, okay? So it comes in, there's a lot of different models that, some of them are just shaped like a hook. This is kind of like an S hook, has a big curve and a smaller curve. And I like using this because it's super easy and super convenient. I'm going to put the end, it has a little ball on it, and I could put that right on that trigger point that I found. And then my hands can be in front, and I could just mobilize that tissue, again, creating that pressure on that spot, that deep pressure, working on some nasal breathing and relaxing that muscle as I work through. Okay, so rhomboids and levator scapula, just like that slide that I showed you earlier, those are the common trigger point areas for that space underneath or in between the shoulder blade and your spine. All right, and so you're going to work on that as needed. And you could do this as often as you need to throughout the day. All right, so the next one that we want to work on is strengthening. So once we get everything moving, we got the joints, we got the soft tissue moving, now strengthening our posture so that we kind of re-educate where our body is going to be neutral. Where's our center, right? So instead of being comfortable with this position, we re-educate and retrain ourselves to be more comfortable and balanced. It doesn't mean like your arms straight, like just totally hyperextended like this, like a soldier. It's more just to be balanced, right? So if we had to build a tower made of blocks, and we want it to be tall and balanced, we wouldn't make it crooked. We would make sure that every block is situated on the one underneath. So for our spine, especially with sitting, what I like to do is start with the pelvis and the lower back, and then just kind of do it like a little tilt. I tilt my pelvis backwards, and I tilt my pelvis forwards. And what that does is it moves my lower back. And then once I find a neutral position, where am I in the middle? Right? I don't want to be hyperextended all the way or hyperflexed. I just find where's the middle. And once I set that base, I look at where my head and shoulders are. Is my head forward? Is it over the shoulders? And once I'm in that middle, again, not totally hyperextended, but just in the middle, then I just relax the arms down by the side. This exercise that we're going to do now is called the Brugger pose. It's basically getting into this position here where we're balanced over our pelvis, and you're going to turn your palms forward. All right. Oftentimes I'll have people do this against the wall to have a reference point of what's vertical. And if you do this standing against the wall, your hips, shoulders, and head are going to be against the wall. That's straight. And then once we get the hands forward, you could put your hands, the back of your hands, to the wall. All right. Oftentimes when people do this, they automatically, when I say put your hands against the wall, they'll do this. All right. It's not the palms, it's the back of the hands. And what that does is it opens the chest up. And then from here, we hold this position and focus on trying to push our fingers into the floor while trying to push the top of my head to the ceiling. All right. So we create that counter strain. Head top of the head to the ceiling while I push my fingertips down to the floor. And I say, all right, can I hold that for, I don't know, 20 seconds, 30 seconds, and do that 2 or 3 times? Or accumulate a minute under tension. And that reinforces a good posture and decreases that stress on these trigger points that we just released with the ball or the back knobber, okay? And let's see, so the trigger point, and we have this, and then I would like to see if we can get into strengthening that rhomboid muscle. So that rhomboid muscle that we just kind of worked on, we want it to be strong and be able to work for a prolonged amount of time so it doesn't go into spasm because it's weak or overused, okay? So the easiest way to kind of strengthen this rhomboid is kind of taking your hand, palm behind the back here, doesn't have to be high, just here, and then trying to stay in good posture, and then raise the hand off the hip, all right? So I'm not doing this, I'm not bending the elbow, I'm just trying to go straight back, all right? This can be very difficult because it is a small muscle, and if you're not in good position, you don't have good shoulder mobility, this can be very difficult to even do off the hip, right? So you want to be able to kind of hold that position similar to the Brugger pose, and maybe like 10, 20 seconds, or accumulate a minute of time under tension. So if I can only hold it for 10 seconds and I have to bail out, maybe just do 6. All right. So these are really simple exercises that you can do throughout your day to kind of get your body moving and address these little trigger points between your shoulder blade and your spine. All righty. So let's come up back to our top end here. So we covered all this: thoracic mobility, soft tissue mobilization, strengthening exercises. I am going to wrap things up here and see if there's any questions in the chat. If not, we're going to close things up and then, let you enjoy your beautiful Tuesday afternoon. All righty, 30 seconds, countdown. All right. Well, thank you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps.